Is there anyone?
And welcome back. I'm Mabel, Jong. Thanks so much for joining us, and a special welcome to those of you who are joining us online. In our studio, we're going to be talking about physician wellness programs, and our guests today are Véronique Grenon and Dana Welle, both of Stanford University Medical Network Risk Authority. Thank you so much for being here.
Thank you.
Well, as I mentioned, this physician wellness programs, that seems quite unique. We talk a lot about wellness programs when we're talking about patients, but this one is geared towards physicians. Dr. Welle, why don't you talk about how this came to be?
Sure. So burnout really became in the forefront in the 1970s when Christina Maslach and her colleagues up at UCSF really studied burnout in their domains. Physicians and burnout and wellness didn't really become an issue until about the year 2000. At Stanford in 2008, we had some tragic events with members of our house staff, which caused our then Chief of Staff, Dr. Brian Bowman, to pay attention to what was going on at Stanford, at both the adult hospital and the children's hospital, and to really realize that if we didn't start thinking about the wellness of our providers, how that could impact the wellness of our patients.
And Véronique, you work on data. Why is it important to look at physician burnout when you're looking at data?
So with data, we're able to build a business case for investing into initiatives that are going to mitigate or reduce burnout and improve professional fulfillment. So for us at Stanford, we've worked on creating a very large national database of burnout and other data that we can track longitudinally and measure the impact of improvement efforts.
Turning back over to what this wellness program looks like, is it different from other wellness programs that address the needs of patients?
It is. So physicians tend to not use traditional wellness programs that are available to them, EAP, faculty programs. And we learned that very quickly when we started to think about our providers that needed support, for example. One of the things that our survey showed was that physicians feel more fulfilled if they're receiving peer support. And that really is very specific, so physician to physician peer support. We developed a program at Stanford where anytime a physician is involved in a difficult clinical event, another physician will reach out to that provider. And that's been a very successful mitigation strategy to help our physicians as they work through different clinical events and different personal events.
And when you say reach out, is it an email, a call, or something deeper than that?
It starts out as an email. And that it invites the provider to reach out with a call, and then oftentimes providers will like to meet in person, have coffee, continue the discussion. One of the things that we know now from the New England Journal of Medicine in 2016, there was a study that 1% of physicians are involved in 32% of lawsuits, and if you aren't helping those physicians mitigate the impact of those lawsuits, and that's what we use our peer support program for as well. Anytime a physician is involved in any type of legal matter, we reach out to those providers to provide support.
Véronique, do your numbers tell you that this wellness program works?
Yes, so we're at the early stages. It's going to take some time to measure improvement. But for example, one of our survey questions had to do with the intent to leave, and we were able to look at the correlation between a physician intent to leave and the burnout. And we were able to see that a physician who's burnt out is twice as likely to leave in the next 2 years its institution. So already here we see that there's a large impact, financial impact to an institution of physicians leaving.
Leave the institution or the profession?
The institution, this question was about the institution, but there are also some statistics that talk about physicians leaving the profession or working part-time.
Okay.
And actually with that work, that was one of the very important factors for developing the formal program at Stanford. We were then able to work with our chief financial financial officer at the university and actually determined how much it costs to replace those physicians. And just the dollar cost alone supported the idea that we needed to put a formal program in place to support our providers.
Is what you're seeing at Stanford any different than any large university medical center in the United States?
So in our consortium, we have now 15 members, and we all are going through the same issues. And yeah.
Okay. And is this more of a recent? You've stated some numbers early on when you looked back in the in the early 2000s. But have you seen that the levels of stress or burnout is greater now than before then? And what do you attribute that to?
Well, so we know from several studies that physician burnout, more than any other source of burnout, is increasing. So several years ago, 1 in every 3 physicians were burnt out. It's now about 50%. So if you can imagine 50% of a workforce being burnt out. And one of the things that we believe it's attributed to is the impact of some of the outside sources, regulatory bodies increasing in medical care, how they actually impact the doctor-patient relationship, which is at the core of a physician. That's why physicians go into medicine. And all of these new, as medicine becomes more complex, delivery of healthcare becomes more complex, the electronic medical record becomes more complex, those really do impact that core doctor-patient relationship.
Any other message that you're leaving with our attendees at the conference?
We need to think about the health of all of our employees, and physicians are often forgotten. So this is something that we are really happy that we can work on.
And Dr. Welle, from you also?
I agree. That's exactly, as we are looking around at some of the wonderful offerings of the conference, we did notice, we thought we need to be thinking about our physicians as employees of the organization as an important component of the healthcare delivery system.
Right, thank you.
Thank
Dina
you.
Welle, Véronique Grenon, thank you so much for joining us. Appreciate it.
Thank you.
And I'm Mabel, Jong. Thank you for watching. Stay tuned.